How much do you know about hemorrhoids? They can affect you without any specific age. Listen to the following and share this super important information with those you appreciate. I could bail them out. Hemorrhoids, also known as piles, are a common medical condition that affects millions of people around the world. They are swollen veins located in the lower rectum or anus and can occur internally or externally. Hemorrhoids can cause pain, itching, and bleeding during bowel movements. The primary cause of hemorrhoids is increased pressure in the veins of the rectum and anus. This pressure can be due to a variety of factors such as straining during bowel movements, chronic constipation or diarrhea, sitting for extended periods, obesity or being overweight, pregnancy and childbirth, and aging. The symptoms of hemorrhoids vary depending on the severity and location of the condition. Common symptoms include itching, discomfort during bowel movements, swelling or lumps around the anus, bright red blood on the toilet paper or in the toilet bowl, and leakage of feces. To diagnose hemorrhoids, your doctor will usually conduct a physical examination of the anus and rectum, possibly using a small device called an anoscope. In some cases, additional tests like a colonoscopy may be needed to rule out other conditions that cause similar symptoms. There are several treatment options for hemorrhoids, ranging from over-the-counter creams and ointments to warm baths, increased fiber and water intake, topical treatments like witch hazel or aloe vera, and procedures like rubber band ligation, sclerotherapy, or surgery in more severe cases. To prevent hemorrhoids, you can take several steps such as eating a high-fiber diet, drinking plenty of water, avoiding sitting on the toilet for extended periods, staying physically active, maintaining a healthy weight, and avoiding straining during bowel movements. Hemorrhoids are more common in adults aged 45 to 65, but they can occur at any age. External hemorrhoids are typically more painful than internal hemorrhoids, but both can cause discomfort and bleeding. Hemorrhoids are not always noticeable or painful, but some people may experience persistent symptoms that can be bothersome and affect their quality of life. Although hemorrhoids are not typically a serious medical condition, they can sometimes lead to complications like anemia, strangulated hemorrhoids, or infections, especially if left untreated. Certain factors can increase your risk of developing hemorrhoids, such as a family history of the condition, a sedentary lifestyle, a low-fiber diet, and chronic coughing. If you have hemorrhoids, you may want to avoid certain foods and drinks that can exacerbate your symptoms, such as spicy foods, caffeine, alcohol, and carbonated drinks. It's important to follow your doctor's instructions and recommendations for managing your hemorrhoids, as they can offer guidance on lifestyle changes, medications, or procedures that may be necessary to relieve your symptoms and prevent complications. Hemorrhoids can be prevented by practicing good bowel habits, such as using the restroom as soon as you feel the urge, avoiding straining during bowel movements, and taking regular breaks from sitting or standing for long periods. Over-the-counter creams and ointments, such as hydrocortisone or Preparation H, can help relieve pain, itching, and swelling caused by hemorrhoids. These products contain ingredients that can shrink blood vessels and reduce inflammation in the affected area. Sitz baths, or warm baths that cover the buttocks and hips, can help soothe and clean the anal area, reducing inflammation and discomfort caused by hemorrhoids. You can add Epsom salts or other ingredients to the water for added relief. Increasing fiber and water intake can help soften stools and prevent constipation, which can aggravate hemorrhoids. Aim to consume at least 25 grams of fiber daily and drink plenty of water to stay hydrated. Topical treatments, such as witch hazel or aloe vera, can help relieve itching and irritation caused by hemorrhoids. These products are available over the counter and can be applied directly to the affected area. In more severe cases, procedures like rubber band ligation, sclerotherapy, or surgery may be necessary to remove or shrink hemorrhoids. These procedures are typically reserved for people who have persistent or large hemorrhoids that do not respond to other treatments. Your doctor may also recommend prescription medications, such as corticosteroids or pain relievers, to help manage your symptoms and prevent complications. In addition to these treatment options, your doctor may recommend lifestyle changes to prevent future occurrences of hemorrhoids. These may include maintaining a healthy weight, staying physically active, avoiding sitting on the toilet for extended periods, taking breaks from sitting or standing for long periods, eating a high-fiber diet, drinking plenty of water, Avoiding straining during bowel movements. Here are some additional tips to help manage hemorrhoids. Other additional tips to help with hemorrhoids can be: avoid using harsh or scented soaps or wipes in the affected area, as they can irritate the skin and worsen symptoms. Instead, use mild, fragrance-free products or plain water to clean the area after bowel movements. Wear loose-fitting clothing that allows air to circulate around the anal area, and avoid tight or constricting clothing that can cause friction or irritation. Try to avoid activities that involve heavy lifting or straining, as these can increase pressure in the rectal area and worsen hemorrhoids. If you must lift heavy objects, be sure to use proper lifting techniques, and avoid holding your breath while lifting. If you have persistent symptoms or bleeding, it's important to see your doctor for further evaluation. In rare cases, bleeding from the rectum can be a sign of a more serious condition, such as colorectal cancer. If you are pregnant or have recently given birth, you may be at an increased risk of developing hemorrhoids due to the pressure exerted on the rectal area during childbirth. Talk to your healthcare provider about ways to manage or prevent hemorrhoids during pregnancy and postpartum. Always keep in mind that if you are experiencing persistent pain, itching, bleeding, or swelling in the anal area, it's important to talk to your healthcare provider. They can perform an exam and recommend appropriate treatment based on the severity of your symptoms. In some cases, hemorrhoids may be a sign of an underlying condition, such as inflammatory bowel disease or rectal prolapse. Your doctor can help determine if additional testing or treatment is necessary. If you have a job that requires you to sit or stand for long periods, try to take frequent breaks and move around to improve circulation and reduce pressure on the rectal area. Consider using a cushion or seat pad to help reduce pressure while sitting. There are also several alternative therapies that some people find helpful for managing hemorrhoids, such as acupuncture, herbal remedies, or yoga. However, it's important to talk to your healthcare provider before starting any new therapies or supplements to avoid any potential interactions or complications. It's also important to remember that hemorrhoids are not a reflection of personal hygiene or cleanliness, and they can happen to anyone. Avoiding self-blame or stigma can help reduce stress and anxiety associated with the condition. Certainly, hemorrhoids are a common condition that can cause discomfort, pain, and other unpleasant symptoms in the anal area. Fortunately, there are many treatment options available, ranging from lifestyle changes and self-care measures to over-the-counter and prescription medications, and in severe cases, medical procedures. By working closely with your healthcare provider and making appropriate lifestyle changes, you can manage your symptoms and prevent future occurrences of hemorrhoids. Remember that while hemorrhoids can be uncomfortable, they are not a reflection of personal hygiene or cleanliness and can happen to anyone. It's important to seek medical attention if you have persistent symptoms or if you experience bleeding or other concerning symptoms. By taking a proactive approach to managing your hemorrhoids, you can improve your quality of life and overall health and well-being. Subscribe to our channel and always take care of your health.